Necrotizing fasciitis, NF. Definition: necrotizing fasciitis, NF, is a rapidly progressive, life-threatening infection of the subcutaneous tissue and fascia that leads to widespread tissue necrosis. It is often referred to as flesh-eating disease. Causes: etiology. 1. Polymicrobial, type 1. Caused by a combination of aerobic and anaerobic bacteria, e.g. Streptococcus, Escherichia coli, Klebsiella, Clostridium bacteroides. 2. Monomicrobial, type 2. Typically caused by group A Streptococcus, gas, Staphylococcus aureus, including MRSA. 3. Type 3, caused by Vibrio species, associated with saltwater exposure or raw seafood. 4. Type 4, fungal infections, often seen in immunocompromised individuals. Sites involved. Common sites include limbs, perineum, abdomen, and neck. Specific syndromes: Fournier's gangrene, necrotizing fasciitis of the perineum genitals. Cervical necrotizing fasciitis involves the neck and can arise from dental or pharyngeal infections. Classification: 1. Type 1, polymicrobial, most common. 2. Type 2, monomicrobial, often gas. 3. Type 3, gas-forming infections, e.g. by Clostridium or Vibrio. 4. Type 4, fungal infections. Signs and symptoms: 1. Early symptoms: severe pain out of proportion to visible signs, swelling, erythema, warmth, fever, malaise. 2. Late symptoms: skin discoloration, dusky, purplish, or mottled, bullae with serosanguineous fluid, crepitus, gas under the skin, necrosis, and foul-smelling discharge. 3. Systemic signs: hypotension, tachycardia, sepsis, multi-organ failure in severe cases. Investigations: 1. Laboratory tests: complete blood count, elevated WBCs, elevated C-reactive protein, CRP, creatine kinase, CK, metabolic acidosis, low bicarbonate, lactate, creatinine, and D-dimer elevation indicate sepsis. 2. Imaging: X-ray may show subcutaneous gas. CT scan detects gas in soft tissues and extent of infection. MRI highly sensitive for soft tissue involvement. 3. Microbiology: blood cultures, wound swabs, or tissue biopsy for pathogen identification. 1. Medical management: broad-spectrum IV antibiotics, e.g. piperacillin tazobactam plus vancomycin, clindamycin for toxin suppression. 2. Surgical management: early and aggressive surgical debridement is critical. Amputation may be required in severe cases. 3. Supportive care: IV fluids, vasopressors for shock, intensive care for organ support, hyperbaric oxygen therapy, adjunctive. 4. Antimicrobial therapy, tailored based on culture results. Complications: septic shock, multi-organ failure, amputation or permanent disability, death, mortality rate up to 30 to 70% if untreated. Timely recognition and intervention are critical in NF to reduce morbidity and mortality.